Let's quickly have the lamp lighting ceremony. I want to invite Professor V.S. Mehta. So Professor Mehta was the Chief of Neurosciences and Chief of Neurosurgery when I was in AIMS. He is my mentor. In fact, he made the neuronutrition program happen in AIMS. That's the way I see it. He encouraged us to do the aneurysm, sir, please. And I quote this to many people. At that time, I had started off, and it so happened that I would say, sir, I can't coil this MCA. And he will say, people, I will also leave a neck. Why don't you do it anyway? So he encouraged backups like this. He actually used this word once, that people, I'm more likely to cause mortality here than you. Why don't you do it anyway? And that's the kind of backing. I'm talking about 25 years back. So he was very supportive. He was my mentor at AIMS. I'm so happy now that I've joined Paras Hospital like 2.5 months back, and he's the chairman emeritus. He established that unit, and he's here now. And I also invite Madam Seema. She's the facility director at Paras. She has been very supportive of the neurointervention program. And she just kept saying, please tell us what you want, and she will arrange it for you. Dr. Padma has already left. And Professor Manmohan, he was my colleague at All India Institute of Medical Sciences. And now he's even a better doctor because he stayed for 15 years more in that great institution, or 20 years more than me. And he's chief of neurosurgery. He's the vice chairman of neurosurgery at Paras Hospital. And Vincent. Yeah, so Professor Vincent runs a very, very big program in France. He holds the slice training course. And first time he held it in Asia with us, 2 days of training program. We will show those images. You can see behind. 3 days, we went crazy. They used 3D models and AI systems to make those 28 students practice actual flow diverters, all these maneuvers. We taught them real time with actual devices. He arranged all those devices, maybe 70, 80 flow diverters we used up in this workshop. He arranged everything, 3D models for us to make it happen. And Matthew and Tufail. Tufail is of course from UK, but to us he's a local Mumbai guy. You know, for us he'll remain so. He's one of the renowned neurointerventions in the world now. And Matthew, you have all seen by his talk. He's one of the best teachers in this country. So all of you, I'm really thankful. As Matthew said, you are not going to suck our knowledge dry. I will not use the extra words which he used. For the last 3 days, they have been very, very busy with us, all of them. And please, sir. I'm so sorry, 1 second. Pallav. This shows when you get fatigue what happens. Dr. Pallav is our chief of neurocritical and neuroanesthesia. He is most important to me. All of you guys, if you want to do well, have neurosurgeons backing, enough knowledge to convince a neurologist, but be very close friends with your neurocritical care people. They save lives all the time. I'm so sorry.
Thank you.
Please join us here. Thank you. So before we start, can you say a few words on behalf of all of us?
Well, I must thank Vipul for organizing such a nice gathering today. I never expected that this will be the strength of the so many people have come. Now, as Dr. Vipul said, when I was in All India Institute, I used to do a lot of aneurysm. And many times, a morning a case will come, angiogram will be done, and meanwhile I'll tell my resident to open the case, and while I'll coming back from my office, I'll clip the aneurysm and go home. And when I went to England, I saw Dr. Golkar doing a lot of interventional cases. So when I came back, I asked my neuroradiologist, Dr. Nalin Mishra, and said, I was very excited to see those cases when aneurysm being coiled without opening the skull. So, but often Dr. Mishra would discourage. No, this is not a good case for coiling. So I quietly go to Vipul and said, why don't you try? And that is how we started. And after the ISET trial, as you all know, there was a lot of debate on whether coil or clip. I think there will be no conference without this debate on clip and coil. But today I think this debate is gone. There is no debate. I would say they are complementary to each other, and most of cases, of course, are dealt by the interventional neuroradiology with very nice, good results because of advancement in technology and, of course, the hardwares and machines. And I wish that this continues to further grow. There are certain complicated cases which still difficult for intervention as well as surgery, and sometimes, and Manmohan is going to talk to you on bypasses in such cases, and the importance lies still. So I feel that practice for both neurosurgeon as well as interventional is essential. And with this, I congratulate Dr. Vipul Gupta for he's a very good technician. I think I have seen his result and our excellent result. And once you see the excellent result, you also feel that yes, because what is best in the patient interest should be done. That is what always I say. And if I give a case in his hand, I feel very safe. Thank you, Dr. Vipul. Thank you.
Now, I think one thing I learned from AIMS is we have to develop, whether we are radiology or teamwork with our clinical team. There is no other way around it. Believe me, if you're doing neurointervention and now you know your neurosurgeon is going to back you up, it changes things. Number two, a lot of our radiology background, we are not used to morbidity, mortality, risk taking. When you work with neurosurgeons, so you have to learn this surgical attitude. What we are doing is surgery by another means. Surgical decision making, clear-headed decision making, protocolized decision making. So we have to learn that attitude as radiologists. Even neurologists have to learn that attitude. Okay? So we have to develop that surgical protocolized thinking. You know, we can't be physics radiology people. We have to have a surgical mind to handle these patients, because it's not a matter of intervention, it's a matter of good outcome. That's how I would say. So just before we stop this ceremony, Madam Seema, would you say a couple of words of encouragement to everybody? Because you need to have hospital backing as well. It doesn't work the other way. You may know all the techniques. Hospital backing is very, very important to do anything. What do you say? And yeah. Yes. All right.
Good afternoon, everyone. And I'm too small to say anything on this platform right now, but I just want to thank Dr. Vipul on organizing such a beautiful event for all of us. I think it's very, very knowledgeable. In just 15 minutes last being in this session, I could see this is really the most knowledgeable session I've ever seen. And thank you so much, sir, for joining us. And I think we have a wonderful team of neurosciences, and I'm sure that we'll be doing very well in future. Thank you so much.
Thanks a lot.